You're welcome to the Backpedia podcast, the official podcast of Kachelan-Pharma Research Limited. And today I have an amazing guest with me, Dr. Akinlabi Blessing. He is the National Sales Manager of Kachelan-Pharma Research Limited. Dr. Akinlabi Blessing is an experienced national sales and marketing manager with a demonstrated history of working in the marketing and advertising industry. Stay tuned.
Hi everyone, I'm Dr. Akinlabi Blessing. I'm the National Sales Manager for Kachelan-Pharma Research Limited.
Thank you so much, and you're welcome to the show. So, Dr. Akinlabi, what are zoonotic diseases?
Okay, zoonotic diseases are diseases that are transmissible from animals to humans and vice versa, basically.
Okay, so I would like you to shed more light on examples of such zoonotic diseases.
Okay, we have quite a number of zoonotic diseases which ranges from, if you can cast your mind back to some years ago when we had issues with Ebola. There is Ebola, there is rabies, and we have bird flu. Bird flu has come to stay in most of the part of the world, and I know that would resonate with you very well.
Okay. Can you let us know what the primary drivers of the zoonotic diseases are?
Okay, the primary drivers of zoonotic disease, I'll talk about the epidemiological triads. We have something called epidemiological triads, and it has to do with the host, agents, and the environment. So those are the things, or we can call, those are the factors that we need to talk about when we talk about zoonotic diseases. So it has to do with the hosts, the human-animal interaction, then the environmental changes, and we now have what is called globalization. So let me just quickly pick them one by one. The host, which is the human-animal interaction. We are in a world that humans and animals interact, and the more they do that, the more they are likely to spread zoonotic diseases. Then environmental changes, things like climate change, deforestation, urbanization, and the likes can make animals move from one location or geographical location to another, and in the process they spread some of these diseases. Then globalization, you know that the world is a global village now, so as people move from one place to the other, they tend to transfer diseases faster.
Okay, thank you very much. In most cases, or let me just say in most areas of the world, people don't know the effect zoonotic diseases can have on public health. So can you let us know, how can zoonotic diseases affect public health?
Okay, the way zoonotic disease affects public health are numerous. For example, it can be devastating when there is an outbreak of zoonotic disease. If you can cast your mind back to Ebola, as we said, it affected a lot of things, and it affected the economy of the world. It affected human lives. It affected activities, generally economic activities. So the effect can be devastating to the world and countries at large. So it can be economical, it can be health-wise, it can be, think of anything. It has a wide range of impact on almost all aspects of our lives as humans.
Okay, thank you for that. Can we ever have permanent immunity from zoonotic diseases?
Well, there is no permanent immunity to zoonotic disease. Most of these diseases or most of the disease causing organisms are either viruses or bacteria that mutate with time. Even if our scientists are trying to create vaccines for some of these diseases, but especially when we talk about AI, that's avian influenza. It's a viral infection that mutates. So if you develop a vaccine against it now, before you know it, the virus mutates and be in another virulent form. So getting a permanent immunity to this zoonotic disease is something that is out of reach for now, but hopefully we never can tell. We might have it in the nearest future.
Okay, thank you. Actually, when you said AI, my mind went to artificial intelligence.
No.
Okay, so what strategies can be put in place to improve the existing surveillance of zoonotic diseases? I know there are strategies already. There are ways to prevent it, maybe quarantine and all of that. Okay, so what new strategies do you think we could put in place to improve the existing measures being taken?
Okay, yeah. There is one aspect that is coming up now, and that's what we call One Health. And One Health has to do with all personnel involved in the health of humans and animals coming together with the environment too. So the people that are involved in One Health are human doctors, veterinary doctors, and public health agencies. So the first thing I'll say is collaboration. We have to collaborate. The government, the public health agencies, and the animal health organizations need to work together to create a strong surveillance system that can cover both animals and human health. That's one of the things that we can do to help our surveillance system. Also, community engagement. Involving communities and farmers in disease surveillance will help us to detect early outbreak of some of these diseases, and the more awareness people have, the more they can guard against and easily report. Then we can talk about report system. We should put in place adequate mechanism to make people report disease as soon as they emerge, because that will help to curb some of these things and it will help in surveillance. So then we can also build capacity, training health workers, establishing disease control centers, and improving laboratory diagnostic tools will also help in spotting disease faster and more accurately. Then for our labs, we have human labs, we have veterinary labs. Some of them handle cases almost every now and then. So from the laboratory, they can also help collaborate and work more on disease reporting.
Okay. Thank you very much for that. As a veterinarian, Dr. Akinlabi, how can the veterinary industry respond to these zoonotic diseases in order to help the ecosystem as a whole?
Okay, there are about 4 or 5 ways that we can respond as a veterinary community. And one of the ways which I've mentioned during the surveillance part is early detection. When we do regular health checkups for animals, we can easily spot disease before they spread to humans. So one of the ways that the veterinary health sector can help is to report early detection of disease. Then a robust vaccination program. If we have a robust vaccination program for animals, it will keep them healthy and stop disease from spreading. Then another thing that we can do as veterinarians is to educate and do outreaches, so that who can help farmers, pet owners, communities to understand the risk of zoonotic diseases and how to prevent an outbreak of some of these diseases. Then I'll also talk about collaboration, because it still has to do with collaboration. Veterinarians working with human health and environmental sector, the people in the environmental sector, so that we'll create a stronger response to some of these zoonotic disease outbreak. And lastly, disease prevention and control. With good vaccination, biosecurity, good animal husbandry practices, we can help to protect animals and prevent some of the spread of this disease.
Okay, thank you very much. It's been so nice having you on the show. Rounding off, I would like you to give healthcare advice to the public, because this part is really important, because taking care of animal health is also taking care of human health, because some people have direct contact with animals, and when they have this, let's say for example they contact a zoonotic disease from an animal, it's going to affect their neighborhood, then the neighborhood transmit to another person, like that it gets viral. So what's that general healthcare advice you can give to people in general?
Okay, about that, there is a particular zoonotic disease that I didn't mention, and that's talking about toxoplasma. That's toxoplasmosis caused by Toxoplasma gondii, or we have some other species, and it really affects cats, cat, and you know that many people keep cat as pets, and in humans, this toxoplasmosis can cause abortion. So if you don't know and you keep a cat and the cat is a carrier of this organism, it can cause abortion. And we can say that some of the abortions we had earlier in life, when it was still very dark, it was in the dark age, many could have been attributed to some of these things, because then they attribute most of them to spiritual myths and things like that, you understand? So people need to be aware. Okay, so now talking about rabies, for example, you know, rabies is another zoonotic disease. We need people to be aware that they need to take the vaccination of their pets serious, especially dogs, because dogs are carriers of these viral carrying agents. So we need to make sure that people are aware of some of these diseases, that they are present in animals and can be easily transmitted to humans. So care must be taken on how we relate with our animals. Fine, we know that some people cannot do without their animals. They call it, they show them affections, they show them love, and so they need to do this with caution. They need to do it with animals that has been vaccinated. And also if I might say, if I will say this, we in Kachelan, we have a sister company that is called Lanchak Veterinary Diagnostic Center. There are, if you see anything that you are not sure of, you can easily bring your pets or your animals to the lab. So with this, let me just say it, that when you see something, say something. When you see something, say something, and don't keep quiet. Report any abnormality that you see in your animals, and you can be sure that veterinarians around you will be ready to help you.
Thank you so much, Doctor, and thank you to the listeners for listening to the end with us. before I round up the show, I'd like to give us few tips on how to reduce the risk of zoonotic diseases. Let's try as much as possible to wash our hands. As simple as this might sound, yes, some people still don't wash their hands after eating, after touching animal environments, or after touching feces or urine of animals. Let's try as much as possible to wash our hands long enough. And also, let us try as much as possible to avoid contact with wild animals. Let us keep up on routine of veterinary care. Yes, routine veterinary care, including blood tests, vaccinations, are very important and should not be ignored. Also, people who have a weakened or compromised immune system, such as those who are receiving chemotherapy or other immunosuppressive drugs, who have HIV or who are chronically ill, are at a much higher risk of developing severe zoonotic diseases. Thank you.